Chapter 8, Calculation of Oral Solid Doses. We'll skip these terms and definitions as we'll cover them in the chapter. And we have the pretest. If you're already comfortable with the subject matter, perform these calculations to test your knowledge. If not, work through the chapter and then return for more practice. Oral medications come in solid forms such as tablets and capsules, and liquid forms such as solutions and suspensions. Variations of solid forms such as powders and granules may be dissolved in liquid for administration. The oral route is the most frequently used due to convenience for the patient, safety, and reduced cost of administration and manufacturing. Oral medications are absorbed in the gastrointestinal tract, primarily in the small intestine. A prescription or medication order is written to accommodate individual differences due to age, weight, and concurrent medical conditions, among others. These differences must be considered by the physician and further checked and verified by the pharmacy professional as a means of checks and balances. Drug manufacturers often provide drugs in different strengths to meet the needs of most patients. The pharmacy technician must be aware of the various strengths of medication and choose the correct drug strength to dispense. Calculation of exact doses and dosages is a critical factor in both dispensing and administering medications. Many drugs are prescribed in the exact amount found in stock, whereas others must be calculated. When the dose ordered is available in the ordered strength and form, no calculations are needed and fewer errors occur. Some tablets are scored to allow breaking them in half or even thirds. Medications that are not scored are generally not to be divided into smaller doses. Some tablets are enteric coated to delay release until they pass through the stomach to either prevent irritation of the stomach or avoid the inactivation of the medication by stomach acid. Enteric coated medications should never be divided, crushed, or chewed. This rule also applies to most extended release formulations and delayed release formulations. Capsules should not be crushed, chewed, or divided, although a few can be opened and sprinkled on food for ease of administration. Be certain of these restrictions when calculating solid doses. The pharmacy technician must be sure to calculate the correct amount of medication to be given to the patient, both for an individual dose and the entire course of therapy. A dose is the amount of medicine to be given at one specific time, whereas dosage indicates the size, frequency, and number of doses of medication prescribed over a period of time. Also, be sure that the medication name is correct because many medications have sound alike or look alike names. Rules that should be considered when calculating medication doses follow. Most capsules that are not meant to be divided or opened. Scored tablets may be divided, but unscored tablets are not typically meant to be divided. Enteric coated buccal or sublingual tablets, as well as most extended and delayed release capsules, are not intended for crushing, dividing, or chewing. Buccal and sublingual tablets should not be swallowed whole, but should be dissolved within the oral cavity in the designated location. If a part of a tablet, usually half, is the answer to a dose problem, be sure dividing the tablet will not alter the pharmaceutical action. The calculations are correct, and the correct medication and strength have been chosen. Always double check your calculations. If your answer seems incorrect, recalculate. If the answer still does not seem correct, always ask for help from a pharmacist. So calculating medications using ratio and proportion. First, write the relationship as fractional units. Note that the known dosage and the dosage form are on the left side of the proportion. So for example, if you have 250 capsules available and you need a 500 milligram dose, they have set up the ratio and proportion. So it would be 2 capsules. Remember that the units of the numerators must be the same and the units of the denominators must be the same since these are equivalent fractions. If the units of measurement differ, a conversion must be performed to bring these components into the same system. All right, so we'll do example 8.1.
Recording in progress.
All right, example 8.1, a medication order is written for fluoxetine, which is Prozac, 80 milligrams, and the stock medication available is Prozac 40 milligram capsules. What is the dose to be given to the patient? So you can see here that they have the proportion already set up. So they have the stock on one side, which is this. So 40 milligrams is one capsule of the stock. We want to give the patient 80 milligrams, and we're going to make sure that our units match across. And it doesn't matter if you wanted to like put the 80 over X here on this side or in the 48 over 1 here. It doesn't matter because they're equal to each other. All right, so we are gonna do exactly what they do and put 40x, and we get that by cross multiplying. So we have 40x is equal to 80 times 1. And they don't have the 1 there because it's just going to be 80. So that's what we would eliminate here. And we want to get x alone. That's what we're solving for. So to do that, we have to get rid of 40. So I'm going to divide both sides by 40. If I do here, I cross that out. Now I just have x. And then I just have to do 80 divided by 40. And that gives me 2 capsules. And you might be able to look at that and say, I don't really need to do a math problem. And if that's the case, perfect. Example 8.2, a medication order is written for 3/4 grains of codeine. In stock, we have 1/4 grain of codeine available. What is the dose to be given to the patient? So if you look at the example in the book, you can probably follow that and understand how they did it. I'm going to do it a little bit differently because I think it's easier to work with decimals than instead of fractions. So first of all, I'm going to take that 3/4 and turn that into a fraction, or turn that into a decimal. And to do that, all I'm going to do is do 3 divided by 4, and that's 0.75, and then 1/4. And you might not know these in your head, and if you do, that's great. 0.25. All right, so now I'm going to do a proportion with the stock strength, which is 0.25 grains. So I know I'm going to need grains here. And that's going to be 1 tablet. And we have an order for 0.75 grains. How many tabs? So we're going to do just like we did in the other example. We're going to go 0.25 x times 0.75 times 1, which we know is just 0.75. Now we want to get x alone, so we need to divide both sides by 0.25. And now we're just going to go 0.75 divided by 0.25. And that is going to give us 3 tablets. For examples 8.3 and 8.4, that is going over how to calculate the same things we just did in 8.1 and 8.2 example, but using dimensional analysis, which we do not use at Ross. So we won't go over those, but you can look, if you want to do them this way, you can read how they did them, and if that works for you, great. But we do not, you won't see examples that way, and we don't teach it that way. Calculations involving different units or measurement systems. These conversions include multiple steps, and they're most easily solved using DA to keep track of units. However, remember, we do ratio and proportion here at Ross. And if you have any questions with using the ratio and proportion, you can definitely reach out to your instructor. However, we do not teach DA here. All right, let's do example 8.5. Even though this wants us to do it in DA, I'll show you how to do it using ratio and proportions. For example 8.5, a physician orders metformin 1 gram, QAM, which we should know by now means every morning. Available stock is 500 milligrams. How many tablets are needed for 1 dose? This requires the use of a conversion factor between grams and milligrams. So by now, you probably heard me say that you should learn 1 gram is equal to 1,000 milligrams. And remember it forever because you're going to need to know it. So true. So this 1 gram that they're ordering is really 1,000 milligrams. So we have our stock, which is 500 milligrams for 1 tablet. We need 1,000 milligrams. How many tablets? Again, if you can figure this out in your head, that's perfect. That's what you eventually want to be doing with things like this. But we'll work it out. So we cross multiply. So the 500 becomes 500x is equal to 1,000 times 1, which we know is just 1,000. And we want to get the x alone, so we're going to divide both sides by 500. So on the one side, we just have x. If I divide that by 500, I'm going to get 2 tabs. A physician orders phenobarbital, 1/2 grain TID. The available stock is phenobarbital, 15 milligram tablets. How many tablets are needed for 1 dose? This requires the use of a conversion factor between grains and milligrams. So 1 grain is equal to 60 milligrams. Also could be 65 milligrams and 64.8. With some medications, actually phenobarbital is one of them, but don't worry about that for now. So we need to convert between grains to milligrams so we can do the problem. So we can set up a proportion. And remember, if we turn that 1/2 into a decimal, 0.5, it's going to make it a lot easier for us to work with. Okay, so now we can figure out how much we need for our order after doing the conversion, of course. So if 1 grain is 60 milligrams and we need 0.5 grains, how many milligrams is that? So for this one, we could do 1x, 1 times x is equal to 60 times 0.5. So this one's a little different because it's not just 1 over there. So first we need to take care of the multiplication. So 60 times 0.5 is 30. And then we still have the 1x. We want to get x alone. So we're going to divide each side by 1. And 30 over 1 is 30. So that means we need to give the patient 30 milligrams. So now we can find out how much is needed for one dose. So we have the order of 30 milligrams. We want to know how many tabs we need to give them. And we have the stock strength of 15 milligrams per one tab. So this one we would do 15 times x, 15x. And again, I could have put that over on this side, the 15 over 1. It doesn't matter. We're still going to get the same answer. Okay, so we want to get our proportion going. So we have 15x is equal to 30 times 1. 30 times 1 is 30. And we want to get x alone. So we're going to divide each side by 15. And 30 divided by 15 is 2. So we need 2 tabs per dose. But then it's asking how many tablets are needed per day. So it says that they're going to take it 3 times a day. So if they're taking 2 tabs times 3 times a day, 2 times 3 is 6. They're going to need 6 tablets per day. Accurate calculations are essential for patient safety. Medication orders or prescriptions are the physician's determination of what medication and dosage should be safe for the patient. The physician, pharmacist, pharmacy technician, nurse, and other healthcare team members work together to ensure that this safety is met. The patient is dependent on healthcare professionals to provide medications that are as risk-free as possible. To be certain that the medication is correct and in the correct dosage form, you should follow certain safety rules. Always recheck calculations after the dose has been figured. Learn and practice calculations until you're confident using them. If you have any calculation questions, check with the pharmacist. Remember that he or she is ultimately responsible. As you work from either a medication order or prescription, verify that what you have on hand is the medication ordered and that it is the dosage form required. Check labels 3 times before presenting the prescription to the pharmacist for verification, before taking the medication from the shelf, before preparing the medication, and before passing it to the pharmacist. Compare the label on the medication with the order from the physician. Be sure that these are the same, being careful of look-alike, sound-alike medications. Do not allow yourself to be distracted. Keep your full attention on the task at hand. Know your medication and the average dose that is required for a patient of the age, gender, and weight of the person from whom the prescription or medication order is written. If in doubt, read the drug insert or other reference materials related to the specific medication before preparing it so that you are aware of the usual dose. Finally, remember that the pharmacist would rather have you ask a question than have the incorrect medication dispensed to the patient.